Dr. Jeff talks love, Dr. Jeff talks life, answers your questions, cuts through the strife. Sex and intimacy, real and true, evidence-based, made just for you.
Welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we explore anything and everything relevant to sexual health, relationships, and intimacy. Thank you for joining us today, whether you're live or on the recording for episode 40, Riding the Perimenopause Wave, Hormones, Health, and Sexuality with Dr. Susan Kellogg-Spadt. Thank you for being here. Thank you so much for being here with us. You are why this podcast exists, and I am so truly grateful for your presence. So thank you for watching and learning. October is Breast Cancer Awareness Month, and I want to take just a moment to honor and acknowledge everyone who is living with or has survived breast cancer. It has truly, truly been an honor and a privilege to be a part of your healing journey. Here's to you, your real heroes. Lately, I've noticed more of my patients feeling fearful, anxious, and less hopeful. If you're feeling that way too, please know you are not alone. We often underestimate the incredible power of connection and presence that we share as human beings. We are hardwired for connection. It's part of how we heal and thrive. Connection is why we're here. It's what gives purpose and meaning to our lives, says Brene Brown. Research from the University of North Carolina has shown that meaningful social connection, not social media, but social connection, boosts oxytocin levels and lowers stress hormones, helping our bodies and our minds recover more effectively. So, who can you reach out to today? And how might you let someone show up for you? Let's make it our shared goal to nurture connection, compassion, and presence with one another. I think we need more of that in the world today. And I know I'm trying to really show up and just be with my patients. And it's such a privilege that they're willing to share their most intimate details of their life with me so I can help them on their healing journey. Well, we are out there on social media. So we're out there on Facebook, we're on YouTube, we're on X, we're on LinkedIn, we're on Kick. If you are on X and you have a question, go to YouTube, LinkedIn, Facebook, Kick, or StreamYard to allow you to send in your questions to us. If you are a Facebook person, please follow us. The more followers we have, the more we can do on Facebook. So please follow us. If you go to the website, you will find all the episodes. Now, this is number 40. There will be 40 different episodes with unbelievably knowledgeable guests. And I think you will learn so much from each of them. You can pull up the calendar and see what's coming up through the rest of the year. We have some wonderful, wonderful episodes coming up, and I hope you'll join us for those. But go to the website, please. Listen to us when you're in your car, when you're working out, whatever you're doing, please take us with you. We're there. We're on Spotify. We're on Amazon Music. We're on iHeartRadio. Where you are, we are. So take us with you. Just want to remind you of this important message that every single person out there is welcome. Whatever your sexual orientation, your gender identity, or your relationship style, you are so welcome here in this space. So thank you for being here. What's the goal of the podcast? I always try to remind people that it is simple. It's just to empower and enlighten you with evidence-based, that scientific information, factual information to improve your sexual health, to deepen your relationships so you can live and love this one miraculous wholehearted life more fully. In today's episode, riding the perimenopause wave, hormones, health, and sexuality. We dive into one of the most pivotal and often misunderstood stages in a woman's life. Perimenopause can bring a tide of changes, from shifting hormones to new challenges in health, intimacy, and identity. But it can also be a time of deep transformation, of empowerment and growth. It can be a challenging time for sure, but to help us navigate this journey, I'm joined by one of the world's leading experts in female sexual health, my friend and colleague, and you've seen her before on the podcast. If you go back and watch previous episodes, you'll see her again, Dr. Susan Kellogg-Spadt. Dr. Kellogg-Spadt is an internationally recognized sexual medicine expert. She is an author and educator who has decades of experience in women's health. She's a certified sexuality counselor and a founding director of the Pelvic and Sexual Health Institute of Philadelphia. Dr. Kellogg has trained and taught healthcare providers across the globe and has been featured in numerous media outlets for her groundbreaking work in sexual medicine. With a unique ability to blend her medical expertise, compassion, and practicality, she has dedicated her career to helping women overcome pelvic and sexual health challenges while fostering greater intimacy and well-being. She is my friend. She is an amazing human being, and I am so excited to welcome Dr. Susan Kellogg-Spadt. Welcome, Susan.
Oh, thank you so much. I'm thrilled to be here. Talk about
I'm
one of my favorite subjects.
For sure. And this is one people have been asking about and wanting. So I so appreciate you tackling it for us. And I cannot wait to hear about it. And I know our listeners are eagerly awaiting. So I'm going to hand it over to you. It's all yours.
All right. My pleasure. So when I think about perimenopause, I think of a roller coaster because a lot of women come in and they are saying, I feel like I'm on a roller coaster. One day I'm up, the next day I'm down, one day I'm hot flashing, the next day I'm freezing. So let's take a look at what this roller coaster looks like. Hang on just one sec. There we go. All righty. So this just shows where I am a speaker and consultant. And here's some changes that are associated with the perimenopause. There's changes in your estrogen level. That's your female hormone. There's changes in testosterone level. That's the androgen or male hormone. There's changes in progesterone, another female hormone. For some women, there's changes in their weight that they never expected. They're like, where did this come from? This little 10 pounds or 5 pounds right in the midline. What's going on with my metabolism? I feel like it's changing. I feel like I can't eat like I used to. Where is my desire? I don't care if I ever have sex again, ever. Or if I do care if I have sex, I can't seem to get as aroused as I used to. Or if I get aroused, I can't seem to reach orgasm the way I used to. Oh, and by the way, what's going on with the skin? And what's going on with these new pains? I'm having muscle pain. And after I work out, I don't seem to recover quite so quickly. What's going on with my hair or lack of? And then what's going on with my mood? So with all these things changing on a sometimes daily basis, of course, women feel like they're not even at home in their own body. It can be a really fun, but very, very bewildering time. So here's the definition. First of all, perimenopause is a natural part of life. The definition is it's the transition period before true menopause, which, by the way, true menopause is no period for 12 consecutive months. So during the perimenopause, you might have a period or 2 or 3, and then skip a month, skip 2 months, skip 3 months, then get a period again. And this can go on and on and on during the perimenopause. But as long as there is a period somewhere in that 12-month window, then you're not finished yet. You're not in menopause yet. You're still in the perimenopause. Ovaries produce less hormones, and the cycles can become very irregular. There can be 28-day cycles, 35-day cycles, 14-day cycles, and this could be in a woman that's never had irregular cycles before. But important to note that with all of this going on, women are still ovulating, and so they can still be ovulating. So essentially, a woman could still get pregnant. This can occur, this business of changing can occur as early as the mid-30s and as late as the mid-50s, and usually lasts about 4 to 8 years, although we certainly know women who are on either end of this, whose perimenopause lasts a year or whose perimenopause lasts 15 years. Sometimes the beginning signs of perimenopause is there will be hot flushes, and that's a flush maybe in the middle of the night where the covers go off. You just put them on, and a few minutes later, the covers are going off. Or a hot flush during the day. Maybe you're doing a presentation at work and you start to just perspire and get really red in your cheeks. That's a hot flush. Night sweats, we just talked about. The urge to urinate might get really strong. So you don't have a lot of notice, shall we say. You have to go to the restroom. And then if you don't get up right now, you might start to leak a little bit. There can be sleep problems. You fall asleep, but you can't stay asleep, or you can't fall asleep at all. And this is all new. This is sometimes in women who slept really well their whole life long. There can be vaginal dryness. Even when a woman is psychologically ready and turned on, the vagina is not getting moist like it used to. There can be pain with sex as a result of that, so that there's just a lot of dryness. And women can have low libido and mood changes. So my goodness, wow. And through all of this, pregnancy is still possible in many women. So they have to worry about things like contraception as well. It can be a really, really interesting time. And again, women are just having a hard time navigating this very often. And unfortunately, sometimes in medicine, the world is very black, very white, no gray. And if there's anything gray in the world, it's perimenopause. You're not premenopausal, you're not postmenopausal, you're perimenopausal, right in the middle. Okay, so the overriding emotion during perimenopause, at least that I hear from women, is they feel out of control of their body. It can cause feelings of anxiety, like, am I going to have a hot flash in the middle of this meeting? Is my vagina going to be too dry to be intimate? They just don't feel like they have a handle on their body. And this can cause feelings of depression and anxiety as well. Many during the day, their mind is racing. They're worrying about things that they never worried about before. They might develop like more muscle tension and more sweating just for no reason at all. They might find it hard to sleep, like we talked about. They sometimes say their mind is racing. They say, a million miles an hour. And that's kind of like an anxiety feeling. Also, if they had PMS before, in those weeks leading up to the period starting, they can say that their PMS symptoms are worsening oftentimes, or they're in PMS all month long. Now, one more time, I must tell you, this is all normal changes. But not really, because wow, you don't feel very normal when you're in the perimenopause, and it can be so disruptive. As Jeff always says, connect and talk with someone. Talk to your healthcare provider, talk to your partner, and say, my feelings for you haven't changed, but my body's changing. Or to the healthcare provider, can you please help me navigate these changes? Because I'm feeling really out of control and I don't know what to expect next. Behavioral therapy during this time can really, really help as well. Seek a good counselor or a therapist who understands that perimenopause is a time of change and a time of trying to get used to the new normal of the body. Now, in terms of diagnosis of perimenopause, this is most often diagnosed by a woman's symptoms, her age, and what she's saying in terms of what's happening with her cycle. Some providers do blood tests, but they're not terribly necessary because the symptoms speak for themselves. If a blood test is done, a woman and her provider can talk about having things like check their estrogen levels or their progesterone, their testosterone levels, or they can check something called follicle stimulating hormone, or FSH. That's a hormone that comes from the brain and tells the ovaries, hey guys, wake up. What's going on down there? You're kind of slowing down a little bit. So as FSH rises, that call from the hypothalamus saying, wake up, ovaries, is getting louder and louder, and FSH levels can rise as a marker for perimenopause. But just when you think you have this all figured out, either as the provider or as the patient, the roller coaster restarts and the FSH goes down the next month or the next week, and then only to go up later on in the perimenopause. So you see what we mean. The hormones that one day are not the hormones the next day. And so it's a rather uncertain time, but a patient's symptoms, her age, and her cycle changes really help us do the proper diagnosis of perimenopause. So what makes symptoms worse? Well, things like sugar, tobacco, alcohol, anger, getting really ticked off at really silly things, like just flying off the table, makes symptoms worse. Lack of exercise, being a couch potato with burgers and fries is not going to take away perimenopause. It's going to exaggerate it. And eating junk food that's high in saturated fat, like sweets and things like pasta, and here you see donuts and brownies and stuff like that. There's a time for, having fun little snacks every now and again, but having a diet full of this will make the perimenopause symptoms really exaggerate. Now, managing the symptoms, certainly many women will come to Jeff or they'll come to me and they'll say, oh, what can I take? What medicine can I take? First, let's talk about managing symptoms without medicine, all right? Because most women don't really need medications to get through this, but lifestyle changes can really help. First, let's talk about water. Put down the soda, put down the beer and wine. Yes, I said it, put down the beer and wine, and have up to 66 to 99 ounces of water. Let's get that body hydrated. You'll feel great. You'll feel much more awake if you have a great big glass of water to start your day, even before the coffee. Increase your ingestion of fresh fruits and vegetables, and protein you see is capitalized there. Protein, very important, about 70 grams of protein a day. Now, if you think, well, what is that? Try to take down, one of the things I ask my patients to do is write down what you had to eat yesterday. Just on any given day, write a whole diary of what you can remember you ate, and then look up how many grams of protein, how many whole grains did you have any fruit, any vegetables, and did you drink any water? And I often will hear, yeah, I've had 2 glasses of water. That's 8 and 8, and that's 16 ounces. Well, it's not 66 to 99, is it? So protein, really important. Protein gives your body that energy to have good muscle strength and energy without dragging down of carbohydrates and sugar. So healthy fats, things like avocado and coconut oil, things like that. Whole grain foods rather than white bread and white pasta, whole grain carbs. Protein, lots of it, 70 grams a day, fresh fruits and vegetables. Perform weight-bearing exercises like walking and weight training. This is a great time to take weight training is pretty seriously as a part of your workout program, because you're going to be building your bone and muscle strength going into the menopause when the bones can get really frail. So start weight training. And if you don't know how to do it, please get a trainer at your gym or someone, at least a trainer online, to help you understand so you don't hurt yourself. Dress differently than you formerly did. Start to dress in layers, like a blouse with a blazer or a sweater, so that the sweater can come off if you start to have a hot flush, and the blouse can be opened for cooling air. So start to dress in layers so you can remove them and put them back on. Avoid things that are set off a hot flash, like spicy foods. Did you know that spicy foods, that, Taco Joe's sauce might really start a hot flash? Avoid caffeine if you possibly can. Avoid tobacco and alcohol. These things are known to make hot flashes happen and make them worse. Have fans in your office, home, or bedroom. There's even personal fans now that you can wear. They clip right on a shirt or a dress. They look like a large-ish pin, and you can turn them on and they'll blow cool air right in your face. So you can have fans kind of all over the place. I always know that when I have an office colleague who is going through perimenopause, because fans magically appear in the hallway, in her office, down the hallway, and God bless her, that's absolutely fine. When you're having a hot flash, really cool air feels great. Practice stress management. When you get stressed out or if you get really angry, hot flashes are going to happen. You're going to, poof, there we go. Perimenopause is going to kind of blow up. So see a counselor. If you don't know how to do stress management techniques, see a counselor, because they can train you and help you. And then avoid a lot of TV or computer work right before bed, because that really, you want to calm down and go into a restful sleep, because remember that the perimenopause is a time where sleep can be really challenging. So before bed, maybe take a hot shower or a cold shower, as the case may be. Dress at night, also dress in layers so that you can take off heavier pajamas and maybe just have a nightgown on. And before you go to bed, do things that are quiet, things like reading or meditating, or listening to music, or just reading poetry or something like that. But do things that are relaxing rather than on the screen, doom scrolling, as they call it, looking up bad news on the news and getting really hooked into Facebook or Instagram and seeing what everybody else is doing. That's perfect during the day, but at night, a really good time to quiet down, quiet your mind. That's a great way to get to sleep. Supplements. Let's talk about a few, shall we? Well, a good women's multivitamin is an excellent idea. It doesn't have to be Centrum. That was just a picture I put up there, but a good women's multivitamin, you can ask your primary care physician or you can ask your GYN what they recommend, but something that is balanced and has many different vitamins. Also at the perimenopause, it's a time for vitamin D3 deficiency. We get a lot of our vitamin D from the sun, but most of us work in offices all day. We don't get a lot of vitamin D, and vitamin D deficiencies can really kind of zap the energy out of people, as can B12 deficiencies, and make the symptoms of perimenopause really much more exaggerated. You can ask your primary healthcare provider or your GYN to see if they can draw a vitamin D3 level and see, or a vitamin B12 and see if you are deficient. Things like calcium and magnesium are important. Magnesium for muscle pain and also to induce sleep are wonderful. And calcium are to build healthy bones. And calcium and magnesium are often marketed in the same pill because they're yin and yang and they actually complement each other. Things like biotin and inositol are helpful for hair growth, hair, skin, and nails. And if you're noticing your hair is changing and it's getting you're looking a little different than you care to, you might want to look at hair vitamins, specifically those that are rich in biotin and inositol. Oh, there are over-the-counter supplements that are formulated to work on hot flashes in the brain. They work at a hot flash center in the brain. They are non-hormonal. And you can you could look them up actually, but you also can ask your gynecologist or your primary care about these, that if they might help with hot flashes. There are other over-the-counter products that work with hot flashes that have phytoestrogens, things like Danquai or black cohosh. Those kind of things do have some plant-based estrogen. And so you're going to be a little bit careful taking those and be sure that you don't take more than is recommended on the label. There are also supplements that increase blood flow to the genitals to help with arousal and orgasm. They are rich in L-arginine, L-citrulline, and pycnogenol. And if you look up those, you'll see many, many products that have these. And what you want to do when you buy a supplement is see if there's studies, particularly by the company that sponsors the ad on Amazon or whatever. You can see if there's studies that shows that this product works and is reputable. Also, don't forget, talk to your clinician, talk to your PCP, GYN, or other providers. Pumpkin seed extract in the form of a product called Go Less is a well-known intervention for people that have urinary urgency. Now, this isn't urgency associated with like a urinary tract infection or anything like that, but it's that gotta go feeling where you feel like you're just not gonna make it to the bathroom. Well, the first thing you do if you have got to go is take down the caffeine in your diet and increase the water. Yeah, I said increase the water. That's counterintuitive because you think if I hold back on water, I won't have to go. But if you actually drink more water and your urine is more diluted, you won't have that urgency. But the other thing you can add in is pumpkin seed extract. And again, look these up, talk to your provider, even talk to your urologist about this. You'll see that this is an over-the-counter intervention that has been shown in studies to decrease urgency. And last but not least, that dry vagina can be a problem. And there's moisturizers for the vagina that are over the counter. We're going to talk about a few of them in a minute, but you want to be sure that the moisturizers attract water into wherever they're placed. Particularly in this case, it'd be put in the vagina and it would attract water into the vagina. So there's lots of supplements that can be taken. But now let's look at some medications. So if a woman wants a medication, or if she tried the supplements and they just don't work, let's look at some other options. So the first is antidepressants and anti-anxiety meds. Now, this doesn't necessarily mean that a woman is making a declaration that she's going to be on antidepressants the rest of her life or anti-anxiety meds the rest of her life. But if she's really, really having a hard time getting through perimenopause, she's not herself. Her moods are all over the map. She's what I hear all the time, I'm yelling at my partner, I'm yelling at my kids, I'm yelling at my students. This isn't me. Please help me. Then the leveling off effect of antidepressants and or anti-anxiety meds might really help. Of course, these are prescription medications and should be obtained from a healthcare provider who has prescriptive authority. Low-dose birth control pills are just that. They're very low-dose oral contraceptive pills. And what they do is they stabilize hormone levels. so that they're not doing the roller coaster thing. They very much stabilize them at a low level. These are not as strong as traditional birth control methods, but they do work to avoid pregnancy, and they also stabilize hormones. A lot of them are called low or extra low, or have numbers that are in the low side. And so you can talk to your gynecologist about this. It doesn't mean that you even need birth control. Maybe your partner has a vasectomy. You don't really need birth control at your house, but you do need the stabilizing force of a low dose birth control pill. Gabapentin, you might have heard of this when it comes to people who have seizures or people who are in chronic pain. It's also called Neurontin, and it's classified as a seizure medication, but it's been proven actually in clinical studies to ease and quiet hot flash behavior and hot flashes. So a very nice low dose of gabapentin is sometimes all a woman needs to kind of level off those hot flashes, foster her sleep, and also make her feel like herself again. If the perimenopause has brought with it lots and lots of new muscle pains and joint pains, gabapentin would play another role, and that is that it would help with the muscle and joint pain as well. Oxybutynin is a medication specifically for overactive bladder that gotta go. Let's say that you're having a hard time with urinary urgency and actually even losing urine when you don't make it to the bathroom on time, and you tried the pumpkin seed extract and you took all that caffeine out of your diet and you're still losing urine and having crazy urges, then you might want to talk to your healthcare provider about oxybutynin in a low dose to help with overactive bladder. Veoza is a new non-hormonal treatment for hot flashes. A few minutes ago, I talked about that hormone hot flash center in your brain, non-hormonal hot flash center in the brain. This quiets that. Veoza works in the brain to quiet a portion of the brain called the NK3 receptor area of the brain, and it quiets it down so that the hot flash behavior really quiets down. This is a prescription medication that most gynecologists and many PCPs know about. When we talk about vaginal cream and lubricants, not all dry vaginas need hormones. What they do need, though, is things that will attract water. So there are things called vaginal moisturizers and lubricants that are over the counter. They're available at most drugstores, and they're also available online. What you're looking for ingredient-wise is something called hyaluronic acid. But don't let the acid word scare you. They don't burn, and they're not like putting acid in your vagina, but they're hyaluronic acid that attract water into the vagina. And so they come in creams and little suppositories. They work very, very well, and they're over the counter. And then last but not least, hormone replacement therapy. Some women talk to their gynecologist and they say they have their blood levels drawn or not. And they say, I just can't take this. I can't take this up and down anymore. For whatever reason, they don't take the low dose birth control pill, and they have their some estrogen replaced into their body. Maybe they're taking a patch or a gel. And if they have a uterus, they need to take estrogen and progesterone because that protects the uterus from getting too much lining built up. So hormone replacement therapy, a very personalized decision, but one that can be shared with a good understanding provider. Now, the last thing I really want to zero in on, because this is Dr. Jeff's sex talk, is that we're going to talk about what happens perimenopause in terms of sexual concerns. Take a look at this graph. This is actually from a study done of postmenopausal women, but these changes start in the perimenopause. So about 57% in this particular study start to avoid intimacy. 65% say they're losing their libido. 35% say they don't feel attractive anymore. 31% feel that they've lost their sexual confidence, their mojo. And 24% feel like they're getting more and more distant from their partner. That's not a happy place to be in. And so even with the hot flashes and the anxiety and the sleepless nights, starting to become distant from the person that means most to you in the world is really very upsetting. And if your sexual response or your sex life is changing, let's see what there is to offer in prescription and non-prescription world. Well, first of all, non-medical interventions, things like sex therapy. people don't always know this, but in sex therapy, you don't have to have sex in front of the therapist. Let me be clear about that. Sex therapists are absolutely trained. Both Jeff and I are trained in this fashion to really get to the root of the sexual concern with a couple or with the woman herself, and give her exercises and assignments actually that really help to kind of refocus that sexual energy and revitalize a relationship. Meditation can do this also very lovely. Meditation helps to center a woman. You feel less frazzled and fragmented, and those racing thoughts quiet down when one is meditating. That can really help to make a woman feel like herself again. And that last but not least, erotic reading. Now, some people think, oh, they chuckle and they think that's funny. But at the end of the day, if you're filling your mind with erotic thoughts, you're more likely to see them show up a little bit later in your life as maybe sexual libido and arousal. But if you're thinking of things just, either watching the news all the time or grocery lists, things like those are not sexy things, not at all. And so they don't feed the libido, they don't feed arousal. So do some erotic reading, and it can be done in the privacy of your Kindle or your laptop, and it really does help. And it doesn't have to be gross erotica. It could be romantic things as well. It could be whatever it is that turns you on and gets you thinking about those kind of thoughts. Okay, the suppositories I talked about, they're hyaluronic acid suppositories. These are available over the counter. Hyaluronic acid attracts up to 1,000 times its weight in water. So this tiny little suppository is placed in the vagina. It attracts water for 2 or 3 days. It's really very lovely. And it can cause a woman to feel cool, less burning, less itching, and it doesn't have any hormones in it, estrogen or progesterone. It just has hyaluronic acid. So these are a great, great finding. And there's actually hyaluronic acid studies done head-to-head with estrogen, local estrogen, and the hyaluronic acid is either as good as or wins over estrogen. So this is a great little tip to use during the perimenopause and during the menopause. Sometimes people, if they haven't yet, they discover assistive devices like vibrators and dilators and things like that to really help with arousal, to get that motor, excuse the pun, motor running. And so if you haven't done this yet, or if you're a little bit nervous about this, talk to your partner, please. Partners are more than happy to kind of open the repertoire during this time of life, because remember, your body's changing. Your feelings about your partner hopefully aren't changing, but your body's changing. So let's make this a team effort and help with arousal and orgasm. There's dietary supplement. I think I told you about this. We're going to keep this program unlabeled, but this is an amino acid complex that is non-hormonal, and it's for feminine sexual enhancement. It has pycnogenol, rosvita, L-arginine, and L-citrulline. Those are amino acids, by the way. And it's been shown in 3 clinical studies to increase blood flow to the clitoris, labia, and vagina, and increase arousal and increase orgasm. And then as a result of increased orgasm and arousal, women have increased desire in many, many cases. So it's a dietary supplement that is available over the counter. And it has studies behind it. Flibanserin is a prescription medication that has been FDA approved for low sexual desire in premenopausal women. It is a receptor agonist that actually, I'll just detail this for you. It increases a chemical in the brain called dopamine that makes one very libidinal and interested in sex. Increases norepinephrine, same thing, interested in sex. And it decreases serotonin so that it decreases kind of the deadening effect or the quieting effect, so that you feel kind of jazzed and psyched for sexual play. It is not Viagra. It doesn't work on the genitals. It works on the brain, and it works with the neurotransmitters in the brain that are responsible for increased desire. It's quite effective. It works in 60% of people that take it. And if it's going to work, it's going to work in just 8 weeks. That's flibanserin, also called Addyi. Another medication that was meant for that perimenopausal transition when women are having a hard time with desire is called bremelanotide, melanocortin agonist, also going by the trade name Vyleesi. This is an injection, like a little EpiPen for sex. It is placed, it doesn't hurt. It's just a little injection that's done usually in the thigh about 12 hours before one wants to feel libido. Actually, pardon me, 2 to 12 hours before one wants to feel libido. And it's on board for about 12 to 24 hours. It increases sexual desire, and it is quite effective. There is a side effect I have to warn you about, and it is nausea. Some people feel a little queasy when they're on this, and so they might talk to their provider about not only getting Vyleesi or bremelanotide, but also getting something like Zofran, so that if they feel queasy, it'll stop that feeling so they can go on and enjoy sex. And then last but not least, I know you've heard about testosterone supplementation. So testosterone is off label for women. That means it is not FDA approved for supplementation in women. So it'd be used off label. But it also doesn't mean that it can't be monitored closely and prescribed appropriately. So if a person has low testosterone and low desire, sometimes providers will give testosterone. The most common kind is a topical gel that's rubbed in at 1/10 the male dose of testosterone. And it tends to be monitored closely so that women don't develop testosterone side effects like unwanted hair growth or voice changes or clitoris changes. And so again, talk to providers. This actually comes in injection, cream, gel, pellets. FDA approved, not for women, just so that you know, but certainly can be effective for desire and arousal. Most women, here's the good news, most women survive perimenopause. Their changing hormone levels, though, do have some risks. They can increase the risk for heart disease, osteoporosis, bone fractures, painful sex, and sexual dysfunction. So that's the bad news. But there are things to combat it. We just talked about supplements and meds. Don't forget to stay active. So important. And if you're not active now, you can get active. Just start walking 20 minutes, 30 minutes a day, and just go out and get some fresh air. It's beautiful fall weather now. Perfect time to start. Take a good multivitamin. Please eat nutritiously. Fruits, vegetables, protein, and water. Talk to your partner. Please open those lines of communication. If he or she has been saying, "Oof, you're a little testy lately," just say, "Listen, I got this. Like, this has to do with the perimenopause. I'm going through changes. It's really not personal. Thank you for being so good and supportive to me. And let's just talk about this. And I'm going to talk to Dr. Smith about this next week and see what I can do." I also learned on this lovely podcast all these lovely vitamins I can take and how to eat nutritiously. And get regular checkups. Make sure that your body is changing in an anticipated way and that nothing else is happening that are giving you these symptoms. So get regular checkups. And our little thing says that many women don't like the word menopause, so you can prefer to call it puberty phase 2. Thank you so much for your attention. And I'm looking for Jeff to come back and say hi.
Hey, awesome. Gosh, so much great information packed in there. Excellent presentation. And I can't think of anybody better to get everybody abreast of this. And we just get so many questions all the time about it, and have so many friends and patients and everything that are struggling with this. So what a great topic, and you covered it beautifully. Couple things. There's so many things I want to talk about with you, but first off, and you alluded to, you talked about that 65% have decreased libido, and you have to think men have 10 times more testosterone before menopause happens in women, right?
Yeah, exactly.
So it's like then when you dive down from 1/10 of the testosterone men have, that could take a real toll on libido. So I know so many women will tell me, it's like, I don't even feel like myself. It's just like and some are like, I have absolutely no interest or desire. I don't know what happened. It's like it's gone. And
they also say it feels like it goes overnight. Like, they're like, "Whoa, what just happened? What just happened here?" And it's not, it can be T, but it also can be T meaning testosterone, but it also can be sleepless nights, sweating like crazy. So not getting a deep sleep and waking up sweating. And maybe, no kidding, Jeff, maybe the extra 5 or 10 pounds around the middle, that doesn't help matters at all, libido wise, not at all. So,
That you bring up, and I love all those points too. You bring up something that I really want to emphasize. First off, when you think, okay, so what is in your body, testosterone builds up during deep sleep. So if you're not getting deep sleep because you're having hot flashes, you're not
yep.
building testosterone. My men too, I say, if you're not getting sleep, if you're up all the time urinating, if you have PTSD and you're hypervigilant, whatever the reasons are, you're not getting that healthy buildup of testosterone. Testosterone is, builds up during the night, and in the morning it's at its best. But it's not doing that if you're not sleeping. And then that weight around the midsection. I love that you emphasized, and we have been emphasizing over and over on this show. If you're a regular listener, you're probably tired of hearing, but it's so important. Exercise, what an impact it has. Diet, healthy BMI, that's your body mass index, your height weight ratio, not having weight around the midsection. It's so crazy that weight you carry around the midsection actually aromatizes your testosterone into estradiol, and so into estrogen, right? And so it's a real problem. So that triad of diet, exercise, and weight control for men and women is monumentally important, and good sleep and lots of water.
What do you think about counseling in the perimenopause?
Oh, I think that is really, really important. I think several things. Number one, I think that women have a really hard think about what it's like to navigate. We said it's a roller coaster already. So I think counseling is monumentally important. And at the VA, we have a MOVE program. We have different things there as well that I think they should have everywhere on. Also, not just working on your mind and what's going on there, but literally it's sort of like health coaching, getting healthier. And I think both of those are super important.
And sometimes people think they're going to be judged if they're going to counseling, but menopause it's in right now. Let's be clear. As everybody talks about it now, nobody talked about it before. And many counselors actually even specialize in menopause and perimenopause, and they really know the language. They know exactly what to do to help you with cognitive behavioral therapy to really handle these, and to just kind of say, this too shall pass, because it will. Nobody stays in perimenopause for 40 years. It just doesn't happen. So, it will pass, but people need to kind of put it in perspective sometimes.
Totally. And what's crazy? And remember, we're always looking at the evidence. There is scientific evidence for CBT, cognitive behavioral therapy, and that it works, and of course, they're always comparing it to medicines, just like you said with the hyaluronic acid. We're always comparing it to the standards of care that are already out there. And you also mentioned, so I want people to know, yes, there are medicines. What's amazing, Susan, and I know you've experienced this too, in the last decade, we had no drugs for women, and we have some wonderful, wonderful medications for women. But if you're one of those people like me who you're like, I don't want to take a medicine if I don't have to take a medicine, there are these other great therapies, cognitive behavioral therapy. You mentioned erotica. Bibliotherapy, that's what it's called. There's research that shows it works. It helps. Getting your mind in erotica helps. And if you're like, oh my God, I can't spend a fortune, go to the library, the romance section. There's sex all over that section,
Right. There's also free erotica download books on Amazon, or you can do audiobooks if you want. There's podcasts that are erotica. I mean, there's lots and lots of erotica. It's everywhere. And people, if they go, like, some of my patients are like, oh, that's gross. I don't like it. I don't like porn, blah, blah, blah. But you know what? There's soft erotica. That's specifically designed for women. It tends to have just a little bit more character development, romance, et cetera, et cetera. So you kind of really get into it. So by the time the sex is happening, you're totally into it. It's not gross anymore. It's beautiful, So there's no reason not to at least try it. At least
I say there's something out there for everybody. And I think sometimes with porn, people are like, I don't want to be compared to those standards. It's unrealistic. It's this, it's that. But when you're reading it, it's all happening up here. You don't have to have all those comparisons, and comparisons are not helpful anyway. But there's something out there for everybody when it comes to romantic and erotic literature. There's something for everybody. And some people love that really hardcore stuff. Some people, I have one patient, she's like, well, my thing is like vampires and stuff. I'm like, there's great erotica with vampires and all kinds of
Yes, absolutely. Absolutely.
sci-fi, you name it, there's erotica. And a lot of it's free. You can get it on Amazon Prime, all kinds of different ways. And there's science behind it. So
Yeah.
don't forget. And remember, you can have a multimodal approach to your problems. You know, you might be trying an herbal thing or the hyaluronic acid, and you might be trying some of these other things along with it, because the sexual dysfunction is also multifaceted.
Yes.
If
Yes.
you have pain, you also often have desire problems and arousal problems, right? So
Right.
multifactorial, multimodal, definitely.
Yep, absolutely. And beyond all of this, communicate, communicate, communicate. Talk to your partner, talk to your provider, talk to your girlfriends, talk to your boyfriends, whatever, but talk about this because people want to talk about it. We're living evidence of that because we have patients come in all week long and they really want to talk about what is happening to my body and can we please talk about this. So please
That's
just more people are going through this than you think.
totally. And that's why we're here. You know, that's why Dr. Jeff talks about sex and intimacy. That's the only reason we exist, is because we want to talk about this and we want you to get good information about it. So, but what's weird is like, we're not wired for talking to our partner about, especially, right? Our sometimes the most communication we do is or yeah, you know, all that kind of stuff. But it's not.
Yeah.
Sit down and converse, and the more you do it, the easier it becomes. You know, you're not going to want to do it in the throngs of intimacy in the bedroom, but have a great, loving, cuddling discussion about, hey, let's talk about intimacy and sex, and it can be really fun. And it's called simmering. It can be there's science that says it can help, you
Yeah,
know?
absolutely. Absolutely.
It's
So I
it's
think the
so
good news
cool.
is that it's a natural part of life. It's not the easiest part. Neither was puberty, oh, by the way. But we all made it through. We made it through. Women who are in perimenopause, you will make it through. But you know, a few things really do help, and a lot of the behavioral stuff and a lot of the nutrition and exercise really helps. And know that there's meds out there if you need them.
Totally, totally true. I'll never forget, I had this couple and he was like, it's just so frustrating. You know, I don't even know. It's like, you know, I don't get her. I don't understand what's going on. And you know, we worked a lot on empathetic joining, trying to get him to really understand. And she said to me, literally, she said to both of us, she said, what do you think it's like for me? I literally feel like a foreigner in my own body. Everything feels so foreign to me right now. So I think it can be really dramatic for some people and less for others. But whatever it is for you, listeners, I think you've heard a lot of great solutions tonight. A couple nice, good questions that came in. The first one is, perimenopause can be confusing, not only for a woman, but also for their partners. How can I communicate what's happening with my body without shame or fear of rejection?
Well, a couple things you can do. At least in my office, and Jeff, in your office too, partners are welcome. I mean, they don't have to be in the naked part if you don't want. They can come in and have a discussion. Also, partners are welcome in counseling sessions very often. And so sometimes we become translators. If you can't find the words, we can find the words. That's what we do for a living. And so so find a translator is what I'm saying. Find someone that can help your partner understand. The other thing is probably the best thing I've ever heard is when maybe there's some grumbling and we haven't had sex for a month, what's going on? And you can say, listen, my feelings for you, my love for you hasn't changed, but my body is changing and it's changing faster than I can hardly keep up with. So let me tell you a little bit about what I used to feel like and what I can't find anymore. Like I can't find my libido anymore. I can't find pleasure in working out anymore. Or I have to work out frequently or something like that. So just try to use words. Just talk to your partner like they're a human being. And maybe if they found their own puberty to be a very wild, crazy ride, maybe you can say, do you remember when you were going through puberty and you felt, this feeling or this feeling, and you wanted to pull away from your parents and you wanted to spend more time in your room and you wanted to be, locked into the TV and you wanted to masturbate all the time or whatever. Like, you're not wanting to masturbate all the time, yes, but you are having a change in your body. And so just try to explain it that way. A little
Excellent.
empathetic and love goes a long way.
But I do think you're right. And we do in my clinic as well. We always highly encourage, I say, if you have a partner or partners, we love for them to be here for a portion of your visit because it can really be helpful. We can answer questions. We can talk about things. And your counselor can be a translator. And even if they don't come, I'll say to them, you can go home and say it's all me. And you can say, Dr. Albaugh told me, blah, 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 blah. And it kicks off the conversation. You can say, Dr. Albaugh told me I should talk to you. We should talk. I should ask you what you want, what you think. So even when they don't bring their partner, it can be a wonderful conversation starter. There's two places that they can find a provider. For women, they can go to Ishwish. And Vic, if you could pull that up. And then as well, so that's where you find a provider. If you're looking for a women's health specialist in sexual health, that's a great place to go. If you're looking for a therapist or counselor, we are dual trained, Susan and I, we're counselors, and you can go to ASECT, which is another wonderful place to go to find providers in terms of therapists and counselors. I have another good question for you that came through. And that is, you've worked with thousands of women through this transition. What's one message of hope or empowerment you'd share with women who feel like their bodies are betraying them during perimenopause?
Probably that this too shall pass, and that there's a whole army of people here to help you. Back in the day, women were so confused, and they were senselessly put on, most of them on Valium. They used to call that mother's little helper. And so they, that's not where we are. We're in a place where people are celebrating perimenopause. They're celebrating getting wiser. You're getting older, but you're getting wiser and more experienced. You're finding your voice, maybe for the first time in your political career or your regular career, or even in your relationship. You're finding a voice because you're wiser and older. And these are growing pains, I guess, is what I would say, but it won't last too long. And menopause actually for many people is just an amazing time of quiet and exploring. They start to retire. They see a whole new part of their life. So rather than kind of going, oh no, not this, go, okay, what's next? See if you can change that.
Definitely. And I know you talked about toys, and I would like to remind our listeners that Dr. Kellogg will be back along with another sex therapist who will be joining us for a panel discussion, and that's on the basics and beyond on outer course, and exploring all kinds of fun ways to, explore each other's bodies, your own body, different things like that. That's episode 43, and that is on October 28th. So that's going to be a fun one. Well, you talked about meditation, so let me do my centering exercise to get people in that space, because I know, and wow, that was some incredible, incredible information. And so we would like to bring you to a space of feeling a little bit better with things and back into your body. So as we close today's conversation, we're going to close out with a couple things, but with this, let's just take a moment to reconnect with our amazing, miraculous selves. If it feels comfortable, get in a comfortable position. Find a comfortable place where you can rest your arms. And if you feel comfortable, gently close your eyes. Place one hand over your heart and one over your belly. If you're comfortable, you don't have to, but if you're comfortable, take a deep breath in. Feeling your chest and belly rise together, and then slowly release. Notice the rhythm of your breath. 3 or 4 or 5 counts in. 4 or 5 counts out. Like waves gently rolling in and out. You feel that under your hands, over your chest and your belly? Yes. So, with each inhale, invite strength, balance, and vitality. With each exhale, release tension, worry, and self judgment. Repeat to yourself, I honor my body. I welcome change. I honor my body. I welcome change. I embrace my journey. When you're ready, open your eyes and carry this calm sense of grounding with you into the rest of your day. I would like to think about what's up next week. So, Vic, can you show them what's coming up next week on Dr. Jeff Talks About Sex and Intimacy?
Injections can be an effective treatment for erectile dysfunction. They can also feel intimidating if you don't know what to expect, and they are not right for everyone. In this episode, Dr. Jeff and his guest, Dr. Kristen Farling, certified urology nurse practitioner, break down everything you need to know. The focus is on their functionality, possible side effects, and suggestions to enhance comfort, safety, and effectiveness. Explore injections with our honest discussion. Gain confidence and knowledge for informed choices about your sexual health. Join us on October 14th at 7 p.m. Central Time to learn more.
Yes, we are going to get down to the nitty-gritty details. There's nothing like one-on-one training that you have to do with these prescription drugs, but we're going to teach you some of the tips and of being successful with that. And I know you're thinking, oh my God, injections sound god-awful into the penis, but we will uncover all that. And it may not be right for you, but if it is, we're going to teach you a lot about that next week. But this week, gosh, what a great episode, and what an important episode to our listeners. Thank you so much for joining me and sharing
My
your
pleasure. Thank you so much for having me. And thank you, listeners, for listening. It makes the job all worthwhile. So
absolutely. And that's the whole reason we're here, is because of you. I hope you learned something tonight. Remember, we've really emphasized how important that connection is. So my hope and prayer for you is that you connect very deeply with all the people that you love, that you have more presence and more joy, happiness, and love in your life. Have a great one.
have a great one.
Who's Dr. Jeff Talks About Sex